Hello, good evening. My name is Dr. Trudy Ufodu of Snow Spirations Global. Thank you and welcome to today's YouTube live broadcast. Today, we're actually going to take a look at the common myth about Staphylococcus aureus infection, fertility, and the effect on the ability to become pregnant. I'm sure you've gone to couple of labs out there, especially if you're in Nigeria, and they've told you have staph. Normally they will tell you it's heavy growth, moderate growth, and small growth of Staphylococcus aureus. Most times you will have a combination of staph and candida. Now, what I'm here to do this evening is to debunk the myth about staph aureus and fertility. The truth about the whole thing is, the jury is back, and there is no direct effect of staph infection on the fertility, both for the males and the females. So thankfully, all those fear factors they normally go out there to put in people when you go to the lab, if you actually take time and go to a well-trained doctor, a fertility specialist, they won't tell you staph is the reason why you don't have a baby, or the reason why your partner is having problems getting you pregnant. So what I'm here to do this evening is to help you to understand what Staphylococcus aureus infection is, what can likely happen to the people that might be predisposed to staph infection. So thank you so much, and I'm going to start. When I'm done with my presentation, you can go ahead and start asking your questions. So what's Staph aureus? Staphylococcus aureus is actually a type of bacteria infection. It's a type of infection we call opportunistic infection. So opportunistic infections are infections can actually go ahead to cause problem when your immune system is down. So by default, Staph aureus is a bacteria that is commonly found in the skin, in the nose, in the armpit, in the pharynx, and in the urogenital tract of about 20% of healthy humans. So by default, virtually everyone out there will have Staph aureus in the skin, in the nose, in your armpit, in your pharynx, in your urogenital tract. About 20% of humans will have it and they won't have problems. Now, generally, when you have staph on the skin, on the nose, on the armpit, or the pharynx, or even in your urinary tract system, you will really come down with the bacteria infection, with the overwhelming infection, if your immune system is good. So you won't have problems. However, if for some reasons this staph had access to your body through a sore, through a cut, it can actually lead to infection in the skin. Now, staph infection in the skin can cause boils, blisters. If we have staph infection in the lungs, it can lead to pneumonia. If we have staph infection in the blood, it can lead to a condition we call sepsis. And if you also have a wound which had staph infection, you can have wound infection from staph. Now, what I'm going to tell you now is very comforting. So all those rumors about staph leading to infertility is actually not true. So from the data we have right now, I know there are so many speculations about the effect of staph on sperm in males and in females and all that. But as of today, there is no merit, there is no evidence in support of Staph aureus stopping a woman from becoming pregnant, in support of Staph aureus causing a significant delay, causing a significant impact on the sperm of a male partner in regards to getting the woman pregnant. So it's not true. So when you go to your pharmacist, when you go to your doctor, when you go to the labs, when they begin to feed you all those lies about Staph aureus, tell them that Dr. Trudy is actually giving you the power to debunk that. Now, what kind of people in the population will have an increased risk of getting staph infection? Remember, virtually everybody out here will have staph in the skin, in the nose, in the pharynx. But if your immune system, it's not in a good place, then you might likely be predisposed to staph infection. So I'm going to mention a couple of people that if they happen to come across staph bacteria, they can have Staphylococcus aureus infection. If you are currently sick and you're admitted in the hospital, you are a likely risk factor to developing staph infection. If you are recently recovering from medical procedure, from surgeries, then you are also at risk. If you live in an overcrowded condition, maybe prison, maybe shelter, children in the daycare, people that use IV drugs, people that have weakened immune system, people that have chronic health conditions like diabetes, like cancer, and even people that engage in sports and military personnel. So the common denominator of all the people I've mentioned is what? The possibility of having a depressed immune system. So anything that affects your ability of the body to fight anything that comes to your body will have a likelihood of increasing the risk of having staph aureus infection. Now, also, Staphylococcus infection has been implicated in food poisoning. So eating food contaminated with staph bacteria can also cause food poisoning. You know, in Nigeria, when we talk about food poisoning, we normally feel, oh, someone put something in the food that will cause someone to die. That's not a medical terminology when we talk about food poisoning. So if you eat a food which is probably poorly cooked and it got contaminated with staph bacteria, you're going to have food poisoning. Food poisoning might present with severe vomiting, severe diarrhea, stomach upset, which can lead to dehydration and a couple of other things. This type of infection generally is not even serious. Once you stay hydrated or you take your Pepto-Bismol, then over time you're going to get healthy. Now, like I mentioned, there is no direct relationship between staph aureus and infection and infertility, both for the male fertility and the female fertility. So if a woman, like this lady is asking a question, she's pregnant, her partner or other member of the family recently had confirmed staph skin infection, what can she do to reduce her chances of getting the infection? Number one, don't touch the person's sore. Don't touch the cut. Don't touch the bandages. Wash your hands liberally with water and soap. Always have your hands in your body. Don't have a direct contact with someone that has staph skin infection. Don't share your towels. Don't share your soap. Don't share your razor. Don't share your tweezers and personal items. Any of these things can be a vehicle to transfer the staph infection. Remember, we are talking about staph skin infection. So if any of your partner, family member, friend actually had a diagnosed staph infection, the best way to avoid picking staph infection is to do what? To observe utmost hygiene. So you need to wash the laundry regularly. If you are living in a place, in the same place with someone that has staph infection, if you are gonna wash the laundry of that person, do due diligence. Make sure it's in a very high temperature so that in that way you're gonna kill the staph infection. Now, is there any relationship between having staph infection and increased risk in having miscarriage? As of today, there is no direct relationship between having miscarriage and staph aureus. It doesn't lead to miscarriages. Now, based on the data we have today, I'm reporting to you, so everything we do in this channel is evidence-based. Now, does having staph infection increase the risk of having birth defects? We also noticed from our review of data that there is no increase in probability of having increase in having birth defect when you have staph. Now, generally, any woman that is pregnant is exposed to risk. Depending on the nature of your pregnancy, depending on your constitutional factor, depending on the environment, depending on your health condition, you might have increased or lower risk. But staph infection is not directly linked to having increase in possibility of having birth defects. Now, some people that have staph infection might notice high fever up to 100 degrees. When you have this, definitely it needs to be treated. Anytime you have fever in pregnancy, we want to make sure that that fever is properly treated. Now, will having staph infection cause other pregnancy complications? As of today, we know for sure that there is no direct effect of staph infection on your pregnancy. But here's the deal. Remember that your growing baby is developing in an amniotic sac covered with an amniotic fluid. If for some reason that amniotic fluid got infected with staph before 37 weeks, you might actually be predisposed to having preterm delivery of your baby. So remember that any baby that is delivered before 37 weeks is termed preterm birth. So this is the only known likely factor, which is not even commoner. But directly, staph infection will not lead to any pregnancy complications. Now, you have staph infection. Can it make it harder to get pregnant? Like I said earlier, there is no connection between having staph infection and the ability to become pregnant. There is no direct relationship between staph and becoming pregnant. So, just in a simple summary, having staph infection, either skin infection, either nose infection, either pharynx infection or lung infection or blood infection will not have a direct impact on your ability to become pregnant and have your baby. Now remember that staph infection is only likely in people that might have immunocompromised conditions. So long as your body system is working properly, you will not likely develop staph infection. Very simple, very straightforward. So next time you go out there, be careful where you spend your money on. Be careful how you abuse antibiotics. Most commonly seen in developing countries like Nigeria, people can easily go to the lab. People can go to a place that will tell them they have staph. They have combination of staph and candida. And they go to the pharmacy and they begin to abuse antibiotics. Antibiotics they don't need. Now, the reason why you have to avoid abusing antibiotics is the fact that when you expose yourself to antibiotics abuse, when you eventually have a need for that antibiotics in the future, you will develop resistance. And when you develop resistance, if you have an overwhelming infection, that antibiotics is not going to be effective. So don't form the habit of going to the lab, of diagnosing staph, of diagnosing candida, and you begin to go for self-treatment. Unfortunately, some people will even use antibiotics to treat fungal infection. Candida infection is a fungal infection. It's not a bacterial infection. So if you are not well informed, some people can even use antibiotics to treat viral infection. So it's important that an infection is classified as bacterial, fungal, parasitic, viral, and we treat it separately and specifically. Very important. I actually made the same mistake I made previously. I'm broadcasting in my own personal channel. I'm going to stop now. Thank you for coming, and I'll get back to you. Bye-bye for now.